Okay. Hi, Dr. Daniels. I'm Laura Shear. I'm sure you're familiar with me. I'm going to talk about abnormal tone today and how to assess for that. So first I wanted to go over some general information about tone. It can be caused by damage to the central nervous system or the peripheral nervous system. So you'll see it a lot of time in strokes, and you might see it in patients with CP. So there's a variety of diagnosis that it can be seen in. Also, it is caused by an imbalance between the agonist and the antagonist muscle. So you'll typically see more tone in the agonist muscle. So it'd be your biceps as opposed to your triceps. So you might see people, they're usually in a flex position. Also, tone varies between joints. So you're going to want to test every single joint separately. Okay, so some things to remember when you're assessing tone is you always want to test them in the same position. So if they're laying down and they can't go to a sitting position, then you can test them in supine or laying down, however, but you're going to want to keep that consistent because a change in position will change the outcome of your test. So it's best to test them in a seated position, but we know that a lot of patients, they have to stay laying down. So you can do that, but just keep it consistent. So for best practice, you're going to want to have them in a seated position on a hard surface like a therapy mat, their feet flat on the floor, and you have to check for any inconsistencies in their trunk position. Are they leaning to one side? Is one arm in a flex position? Is the shoulder drooping? You want to compare each side of the body. So look for that. And then you want to always make sure that you hold the limb on the lateral bony aspects. So you make sure not to touch the muscles, because if you do, that can cause the muscle to contract and it'll throw off your assessment. You're going to get different results. Also, another thing to keep in mind is there are other factors that affect tone. Fear can affect tone, anxiety, constipation, having an ingrown toenail. All sorts of factors go into tone. So just keep that in mind. Okay. First, you're going to want to take the limb in your hand, compare both limbs, move the limb slowly through passive range of motion, and while doing that, you're going to see whether the limb feels heavy, does it feel light, is the patient in any pain. You have to always check for pain first before you start moving the limb quickly. So make sure you do that first. And then secondly, you're going to move the limb more rapidly through range of motion. So holding it on the lateral aspects, you're going to move it quickly like this. And you want to take note of whether the limb catches and where it catches. So if it catches up front in the beginning range of motion, or in the middle, or at the end, that is going to tell you how you rate the tone. So we'll look at the scale next. This is one of the ways to rate tone. It goes from moderate, mild, moderate, and severe. Severe tone would look like a catch in the beginning of the range of motion. Moderate tone is going to be a catch in the middle, and you're going to have to approximate whether it's in the middle. You're probably not going to know exactly for sure, but you can approximate that. And then mild tone is going to be a catch at the end. So you're looking for the stretch reflex catch. That's what it's called. So pay attention to that. And then I have another scale that I found in our book. It assesses normal tone to a rigid limb. So it's a scale of 1 to 5. 1 is normal tone. So the unaffected limb feels just like the affected limb. They're the same. The tone's normal. 2 is a noticeable catch with the limb. So you're going to notice that the palpable catch that we discussed earlier. A 3 is there is significant tone, more significant tone, but the limb still moves easily through the range of motion. And then when you get to a 4, the tone is more moderate, it's more severe. So it's going to be difficult to get that limb to move at all through the range of motion. And then 5, you have the severe tone. The limb's going to be rigid all around. So that's how you rate that. And then I have a video to show somebody doing a tone assessment. So we'll watch that just so you can get a better visual than me whipping my arm around.
So we'll be looking at assessment of muscle tone today in a neurological patient. I've got Craig here. be doing is pushing the upper limbs through a passive range of motion to detect muscle tone. So what we're going to do, start off with flexion extension. What we do is just put it through range of motion.
He's holding the lateral bony aspects.
Quicker.
Slow at first and then fast.
Supination and pronation.
And this patient has normal tone, so you're not going to see a catch.
Wheel and lead pipe rigidity may indicate Parkinson's disease. Increased toe may be indicative of motor neuron disease. Low toe may be indicative of lower motor neuron disease.
And I'm not sure if his feet are on the floor, but they should be, so. The wrist, fingers. All right, so there's a visual for you, and that is all that I have for you. And then there is my references. Thank you.